Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas, and I'm here to talk about an exciting new medication to reduce cholesterol called Welchol. Welchol is a new and improved medication that belongs to a class of cholesterol-lowering medications called bile acid binders. Welchol works by physically binding to cholesterol in the intestines of the body. The cholesterol that is bound in the intestine is harmlessly removed from the body in the stool. This is how Welchol lowers blood cholesterol. Through an unknown mechanism, Welchol actually increases the HDL, or good cholesterol. The greater the dose of Welchol, the greater the reduction in the bad LDL cholesterol. This graph shows the increase in LDL cholesterol reduction when Welchol is given as 2, 3, 4, and 6 capsules per day. This graph shows the increase in HDL cholesterol as Welchol is given as 2, 3, 4, and 6 capsules per day. The more Welchol taken per day, the greater the improvement in serum lipids. One of the biggest advantages of Welchol is that it is not absorbed into the body. All of the Welchol taken by mouth exits the body in the stool combined with cholesterol. For this reason, Welchol has virtually no side effects. In a large trial of patients given either Welchol or a placebo, there was little difference in the amount of constipation, diarrhea, abdominal pain, or any other side effect between the two groups. Furthermore, since Welchol is not absorbed into the body, there is no effect on the liver. In women of childbearing age, Welchol is generally the preferred cholesterol-lowering medication. Welchol can increase triglycerides slightly in some patients. Perhaps the most important thing about Welchol is that it is a bile acid binder, and bile acid binders have been proven to lower not only cholesterol, but also the risk of having a heart attack. In the LRC study, 3,800 men with total cholesterol levels above 265 were split into two groups. One group received a placebo, while the other group received the bile acid binder called cholestyramine. The average LDL was lowered by 11%. After 7 years, there was a 24% reduction in heart attack deaths and a 19% reduction in all heart attacks. Another nice feature about Welchol is its ability to work with other cholesterol-lowering medications. For example, when a person takes 10 milligrams of lovastatin per day, the bad LDL cholesterol will be reduced by 22%. If low-dose Welchol is given in addition, the bad LDL will be lowered another 12% for a total of a 34% reduction. To obtain this amount of reduction in LDL by using lovastatin alone, 4 times as much, or 40 milligrams of lovastatin per day, would have to be used. By using low-dose Welchol in combination with other cholesterol-lowering medications, very large reductions in cholesterol are possible and safe. Additional cholesterol reduction will further reduce the risk of cardiovascular deaths. In the Air Force Coronary Atherosclerosis Prevention Study, the risk of having a heart attack or stroke continues to fall as the LDL cholesterol fell down to a level of 85 and below. In other words, the lower the LDL cholesterol, the lower the risk of heart attack. The full dose of Welchol is 2 capsules 3 times a day, or 3 capsules 2 times a day with the first bite of a meal. Welchol can be taken with other medications without causing a problem. When using Welchol in combination with other cholesterol-lowering medications, 3 capsules once a day before a meal is typically used. If additional cholesterol lowering is needed, the full dose can be used. The major differences between Welchol and the other bile acid binders is that Welchol does not interfere with the absorption of other medications, and Welchol rarely causes constipation or abdominal pain. In summary, Welchol is an exciting new medication that works by physically binding to cholesterol in the intestines and pulling it out of the body. The advantages of Welchol are that it is not absorbed into the body. It has virtually no adverse effects on the liver, and it has minimal side effects. Welchol works very well with other cholesterol-lowering medications to really reduce cholesterol levels. Since Welchol is a bile acid binder, it will not only lower your cholesterol, it will make you less likely to have a heart attack. I am often asked if Welchol needs to be taken for the rest of a person's life. My answer is simple. Within 4 weeks of taking Welchol, your blood cholesterol will fall and your risk of having a heart attack will fall. Once Welchol is stopped, the blood cholesterol levels will increase back to the previous values and the risk of having a heart attack increases. Therefore, I advise all my patients to take Welchol until they are 95 years old. Once they reach 95, they can stop all of their medicines and have a party. I hope this educational program has helped you understand the action of Welchol and why we use it. This is Dr. Eli Whitney with the Heart and Vascular Institute of Texas.